second here. And with that, we'll go ahead and jump in. My name is Olivia Orndorff. I'm the Chief of Staff here at the National Resident Matching Program, and I'm joined by 3 colleagues representing the Pediatrics external folks. Do you all want to just introduce yourselves real quick to the group here?
Hi, everyone. I see some friends on the call. Megan Ehler, Residency Program Director in Portland, Oregon, and President of APPD. Joanna?
Hi, everyone. Good to see you. Joanna Lewis, Residency Program Director at Advocate Children's Hospital, Park Ridge, and Chair of the APPD Residency Recruitment Action Team.
Yep. Hi, everyone. I'm Chris Rooney. I am the Program Director for the Residency and the Vice Chair for Education at Lehigh Valley Riley Children's Hospital and the Vice Chair of the APPD Resident EC Recruitment Action Team.
Great, thanks. And thanks everybody for joining the call. Just so everyone has a sense of the agenda, we're going to go through just a few overview slides on what the pilot is. And so feel free to start repopulating the chat with any questions that you may have. And then once we run through the slides, really the rest of the session will be on any questions folks in the room have or folks our reps have had received, and we can kind of go through all of those. And so hopefully this will be a good resource for you all. I just like to give that warning so people can start thinking about their questions. So as you all may already know, the voluntary ROL Lock pilot was intended to help both programs and applicants in terms of the virtual interview and then that second look or post-interview process. So we're coming up on the deadline for pediatrics programs. For those that want to participate, you'll want to go in and select yes by October 3rd. When you do this, applicants will be able to see that you're participating in NRMP's R3 system. The applicants will also be able to look at those that have locked once that process happens. Once ranking certification opens, programs will be able to certify and then lock their ROL. And once you lock that rank order list, you will not be able to change it. And the whole purpose of that is so that way applicants know they can come or not to those post-interview visits, with the goal that it really is for applicants to be able to get a sense of your program, get a sense of the place, get any maybe questions answered, but so it's not a second interview. It really is intended to just be that optional visit. So the timeline for this process, so we're in the thick of it now in terms of signing up for the deadline. And once we get past that deadline, really the next phase is just being able to provide information to applicants on how they'll be able to sign up and confidentially RSVP for those post-interview visit dates. And then once we get through that, it really is going to then just focus in February on making sure that you have locked your ROL by that February 9th date, or at least 24 hours before the first post-interview visit, whichever happens first. And then of course, applicants will have until March 4th to certify their rank order lists. And then in March, everyone that's participating, we would encourage you to fill out the survey NRMP will be distributing to see how the pilot went for you, how you thought the process went, if it was effective, and various questions like that. So how to sign up? If you go into NRMP's R3 system and you go into your program details page, you will see a voluntary ROL Lock participation. This is an opt-in pilot, so you will have to select yes or no, and then you can save it. This is at the track level, so you would need to go in for any of your tracks and select an answer. This means you can select different options depending on what track it is. So if you have, say, a preliminary program you don't think would necessarily benefit from participating in the pilot, you could select no for that and yes for your categorical. So this is what applicants will be able to see. They can go into R3 and search. So this is their search page here, and they will be able to see, you know, did the program say they're going to participate in the pilot, which is shown with the kind of unlock there. And then if they are going to participate and then they lock their ROL in February, they'll have that lock their symbol as well. So we do have a lot of resources on the match page. This recording is going to be up there as well. And this is the page link where you can find it. And so with that, we can kind of start turning to our questions. So let me go ahead and stop my share. And I know there were some questions that we got in advance. So as those, they're kind of coming in through the chat, or if folks want to raise their hands for questions. Joanna, Megan, did you all want to kind of talk through some of the questions you all have been getting.
Olivia, question on the screen for the applicant view, when it's an option to see like if programs are participating, does an applicant have to manually search through all the programs? Is it because it's not associated with where they've applied, right? So they would just have to look, can they like favorite, or each time, let's say they interviewed at 13 programs, they're going to have to search all 13 individually each time? How does that work?
Yeah, so hopefully the hope would be after October 3rd, they would be able to go in and look at those 13 programs they're interested in. If they have the NRMP program code, they would be able to input that in directly and then they can go look. Right now, we don't have it with a filter sort of system. And part of that is just the balance of it being a pilot and how much functionality, we kind of went in for this first year.
Thanks so much.
Olivia, other questions that I've heard is if I, as a program director, sign up for the voluntary ROL Lock, but whatever happens along the way with recruitment season, we are not able to lock by that February 9th date, what happens to my program?
Yeah, so from the NRMP side, the main thing to consider there is if you're not able to lock your role, you still need to make sure it is certified by the certification deadline. That won't change. You will need to do that in order to kind of make sure your role is included in the match. In terms of kind of messaging and different things like that, you will need to let anyone that interviewed at your program that you had sent out about the post-interview dates know the role, isn't locked, so that way they can then make the decision on whether they still want to come and participate, or if they kind of want to make a different decision now that they have that new information. So that'll be kind of what will happen in that situation.
So I'll ask another follow-up, this prompts, because I'm thinking very specifically now about my own program. If I have a second look visit on the 15th, and I can certify my list on the 10th, the applicant won't see that lock is done because the window has passed, for the lock window has passed. Is that correct?
They actually still would be able to lock. So if you can lock after that, you can lock in before the visit. The hope would just be that most folks are doing it by the 9th, mainly so applicants can go in and double check.
Sure.
So they would still be able to do it and still be able to see. But the main hope is that February 9th date, mainly for applicants' sake, so they have a kind of surefire way when to go ahead and look.
Thank you.
And I think you just answered one of the other questions that I had heard, but just clarifying, the applicant will only be able to see if the rank order list is locked or not locked. They are not getting access to anything that says this program says they're going to, or anything like that, right? It's just after that certain date, have they locked or have they not locked?
So what they'll see, thank you for that. So what they'll see is, did the program director sign up for the pilot? Did they lock their role? Those are the two things that they'll be able to see. And so that's the only thing it'll see in the system there. So they won't see how many times you certified or uncertified or anything like that. It'll just be, have they locked?
So in a scenario like Megan's, is it?
I'm so sorry, she froze for me. Yes, okay.
Me too.
The whims of technology.
Mm-hmm. Joanna, you're muted. I don't know if you're talking.
Yes, I said she froze for me as well, but any questions from anyone in the group, you can unmute and ask, or you can put them in the chat. Okay, Chris, you're back. You want to try it again?
Yeah, sorry about that. I basically was just asking, is there a scenario where if someone said, yes, I'm going to participate, and then something changes and they recognize that they are not in fact going to be able to lock, is it in any way recommended, or is it even feasible, to update your participation status? Or Are we just saying it should just say they said they were going to, but their list isn't locked? Because I can imagine that could look differently than if you somehow had a way of updating your participation status.
Yeah, so how we're doing it this first year is once that October 3rd date rolls around, the participation status is set where it is. And so and to be fair to your question, I mean, that's going to look a little different if you know during interview season, something changed and you can't, because that can just help, with the messaging there. But again, the thought would be if you're going to participate this first year that you would lock your role.
But I think, Olivia, just going back to what you said is, I think the expectation enrolling in the pilot is then if you decide in the end you're not going to lock, that you need to communicate that to everyone
Yes.
that you interviewed. And then I would just say this is not NRMP, but just the Residency Recruitment Action Team recommendation is that if a PEDS program is going to host an in-person second look, our strongest recommendation is that that program participate in the pilot. That is really to ensure from the applicant's perspective that they are not confused, like that, they would know that in PEDS, if someone's hosting a second look, our ideal situation is that all those programs have locked their list, have not done what some programs did last year and just promised that they're not going to change them. And Olivia, you have the updated numbers as of today, right?
I do, yes. So happy to report that we have tipped over that 50% in pediatric programs saying yes. And so what that looks like at the track level, NRMP track level, not ACGME program level, is that we're at 144 have said yes. And we've still got 80 or so that have not responded one way or another yet. But we are at a little over 50% for pediatrics as of today.
And how many have said no?
We are at 59 have said no. And again, that could include, say, a preliminary track or another kind of track there.
So another question that's come up about the tracks is, let's say that you have 3 tracks at your program. You have a prelim track and you have a categorical track. Even let's just start with that. Or let's say that you have like a combined, like a primary care PEDS track or something. So if you chose to only only participate in the ROL Lock for your physician scientist development track, then those are the only people that you would need to invite for offer that to, and you wouldn't have to invite for your whole categorical program if the categorical wasn't invited. That would not be violating the pilot because it's only for the track that you select, correct?
Correct. And that's why we set it up, in talking with all the specialty reps, that's why we set it up that way, is acknowledging that different program tracks have kind of different needs on what this is going to look like. And so that would be the expectation is if the track is participating, the interviewees would need the information. It would not need to go out to everyone that applied, say, to all the different tracks. And I see that we've got a couple of questions in the chat, which is exciting here. So the first one from Jill we have is, would it be a negative reflection on a program in the eyes of the applicants if a program does not participate?
So I can try to answer that if that's okay, Olivia. So
yeah,
we have tried very hard to make it clear to applicants as much as we can, communicate with applicants that this is a pilot and this is the first year of a pilot, and that many programs would have multiple factors for, deciding to participate in the pilot or not. And this was why for pediatrics, we did not make our deadline till after the match, because after ERIS opened. We didn't want applicants to be making decisions about where to apply based on participation in the lock pilot or not. I would say that applicants, what I said before, might be confused if a program was not participating but chose to have an in-person second look. I think that's more, Jill, where the confusion might come, as opposed to a program that just chooses not to participate, because we've been as clear as we can that this is a pilot and that we should not expect 100% participation in PEDS. I hope that helps answer the question.
And I think the only thing I would add, if I may, is I think it's unlikely in terms of wording that an applicant will think negatively about a program, but it is I think more likely that if you are in that scenario that Joanna just described, where you're offering in-person second looks and not participating, that the applicant might be nervous as to whether or not it is going to impact whether they attend or not attend. And that's the whole point behind this, right? We're trying to prevent that sense of, oh my gosh, if I do or don't attend, will that matter where they rank me? So I don't think it's as much a negative view of your program as it is anxiety about what attending or not attending could mean for them.
Great. And I would say the NRMP is also going to be surveying applicants that at least put one program, say from pediatrics or internal medicine or vascular surgery on their rank order list to see what their experiences of the pilot was. And I think by next year, we'll at least have some of that kind of survey data to get a sense from applicants, kind of what they thought or what they saw, which I think will be helpful as well. Now in the chat here, I see another question. We've got, regardless of the voluntary lock, can applicants view if the ROL is locked for a program? So they cannot. And so so let me just break this down in this way. If you sign up to participate in the pilot, you say, yes, this track is, and then you lock, applicants can see that. If you say, no, I'm not going to participate in the pilot, or you leave that blank, you won't have the locking functionality. You'll just have the certification functionality. So it'll look the same way it does to applicants every year. So it won't be visible that you have certified or that it is locked, because you won't have that locking functionality.
And just in case that question comes from someone new to the process in general, right? Prior to the lock, really everybody locked because a certain date rolled around where you could no longer alter your rank list, right? So that's the difference this year, is there's an early date, and that's why there's actually a designation of locked or not locked.
And some of what's happened in the past is a confusion in the word certification versus lock. So in the past, programs might have said, well, they certified their list, but that can always be changed up until the final date, which was like the March whatever date. And so this year, if you participate, it would be that after that, you could not change it. But some people said they locked it, but they really didn't lock it. Yeah.
Olivia, I got a private message with a question. We saw those lovely screenshots of how to sign up. When it comes time to certify and lock the list, is there anything we need to know about navigating that page? And is it just going to be, I know we can recertify our list as many times as we want, but is there just going to be another button that says lock? What's that going to look like for us as we are actually completing that? And I assume it's going to look different for the pilot groups than it does for those that are not participating in the pilot.
Yeah, so for those who are participating in the pilot, once ranking opens, you'll go in the same way you always do to the same interface in R3 to set your rank order list. You'll certify. If you want to uncertify, as you mentioned, Megan, you can do that. And then once you're ready to lock your ROL, it'll be a different button that says lock your ROL. And we're trying to make it as obvious as possible. That's what you're doing. We're putting a lot of bold, we're highlighting things, exclamation marks are being used. Like once you do this, you can't change it. And then the person that's going in and going to lock the ROL will put in their password. So again, kind of making sure it's that emphasis that you are locking it, and you click the button that says you are locking the ROL, as opposed to when you are certifying, you're kind of doing a confirm. So this one's locking. So it will be a different kind of button there. And then if you're not participating, that just won't even be an option for you on the screen. You'll just go through the same way you always do to certify. So right now, I see the question on, is it a PD only function? So right now we have it with the same users that have the ability to certify a rank order list. So it would be program directors, and then those institutional officials and administrators would also be able to lock. It would not, so program coordinators would not be able to lock.
I think I know the answer to this, but I'll just ask. So we've locked, and then somebody who is on our list there is an egregious offense. We read in the news that they've been convicted of a felony, let's say. Is there a means through the NRMP before the applicant certification before the regular certification date to sort of make an appeal to remove someone from the certified ROL if there are dramatic extenuating circumstances.
No, if the ROL is locked, it is locked and it cannot be changed. I think if that's something that you're seeing, and if the applicant does choose to rank you and different things like that, it would then go into kind of the NRMP policies related to needing to request perhaps a waiver. So great question from Jill if there's other specialties that have already done a pilot. So internal medicine and vascular surgery integrated have done this with kind of smaller cohorts of programs. It did not have the locking functionality in R3. So it was again a situation where they were telling applicants that it had been certified and would not be changed. If you are interested in that, I can put the link in the chat for the FAQs where we do have the kind of papers that those specialties published out of that, so you can kind of get a sense of how they approached some things there.
And Jill, just for some context in PEDS, when we surveyed applicants about this, about 50% of applicants said they didn't believe programs wouldn't go in and then change the list based on whether they came or not. And so that's really why we decided to join, we're hoping to join the pilot so that they could have a little bit more sort of security around that. It is, yeah, from the applicant perspective, they were concerned about that feature. But Olivia, can you share with us like what the percentage is of the internal medicine programs that decided to do the lock since their deadline already passed, just so we have some frame of reference?
Yeah, and I would say in giving these proportions, internal medicine is a lot bigger in terms of number of programs. They have over 1,000 program tracks in. So their yes is at about 22%.
Yeah, I think many of them from the conversations we had didn't think for their prelims, which can be like a huge portion of those tracks, that this would be something that they would do. And so I'm sure that skews it a little bit.
I think that is what I'm hearing. And then I think what I'm also hearing is there's different rates in the number of programs doing even in-person, visits, which I can then understand why you might not think it's necessary to do a pilot like this if you're not doing those post-interview visits.
I just want to clarify too for everyone, there is no expectation that just because you lock early, it means you have to host in-person visits. So it could be that, what Megan was saying before, all of a sudden your program is under a circumstance where you're not going to host visits or you don't want to. But if you participate in the pilot and you lock your list, then you're just also done. So there's not necessarily, this does not mean you have to host an in-person visit. You could do virtual visits if you want, anything. So I don't want people to feel, I think most people probably will have something and that's why they're doing this, but it is not a requirement of the pilot that you have something post-lock.
Yes. Yeah. Yeah. I think to Joanna's point, I think that's just the framework we had heard was the need for the pilot, but it's not definitely the only way to approach visits or interacting with your interviewees. Do we have any additional?
I would say one thing about the RSVPs. So that's another question that had come up. So the requirement for the lock pilot is that anything done prior to the lock date, the RSVPs are collected by like a third party somewhere where the program does not know who is responding. So there's a couple different ways that programs are planning to have done that or have done that. So I can tell you like personally what we're doing in our program is that someone from our central GME office is taking the RSVPs. So we are saying if you're going to RSVP, send it to this office. And because I just wanted to know how many people were RSVPing before February 6th. Like if I'm going to host something on February 13th, I need to know like how big of a room I need and all of those sorts of things. So we made it clear to applicants that was going to a different office. and they just told me like how many people, they'll tell me like, oh, you have 12 people that have registered, or 6, or hopefully not 60, right? And then after we've locked is when our coordinator will then reach out to people, because she will then get the names to say like, here's where you're supposed to show up and here's the parking and all of that. Some people might choose to let all the interviewees know when the dates are going to be, but not take any RSVPs until after that is locked, after the list is locked. If you do that, then you can be in contact with everyone that you wanted to. And then you could use like a Thalamus survey tool or Thalamus invite or something. But those, and then I know there was a program last year that was doing like a trial of this, and one of the internal medicine programs had a separate software. So I think they used like an interview broker or a sign up genius that went to somewhere else. But I don't know if applicants really believe that that's going to somewhere else or not. So, but that is a requirement, is that the program does not know who's RSVPing before the lock date.
And Megan, Chris, you all answered in the chat, but I don't know if you also want to just talk a little bit more too about what you are planning for your second look day.
Yeah, I can say what I typed essentially, but similar to Megan, we do usually pick 2 or 3 days that the people that are interested can select from, just to allow them to have a little bit of flexibility. And one of those days is usually a weekend day, interestingly. But it's very little budget that we actually even have to work with, let alone our designating to it. So they come in, they attend a conference if it's a weekday, or they don't if it's a weekend. They tour the children's hospital. They have a quick meet and greet with program leadership. This year they will, and then they get to go to either brunch or lunch with just a few of the residents. And the brunch lunch is really the only budgetary item. We do not have approval to utilize any type of funds to support travel or lodging or anything like that.
And we have been telling applicants that like we recommend that they plan to attend like 0 to 3 of these events, that like they're really for them, places they feel like they need to see the area, or they didn't get as, you know, the sense of the program that they needed, that they should not be spending like 3 weeks in February going to 10 visits. Hopefully they'll listen to us, but you just sort of never know. That's one thing that we're going to track.
And I would add, just as a little word of advice, we also are really trying to be cognizant to recognize the extra stress this puts on your faculty, your residents, the program, right? You've just gone through an entire interview season, and then there's these second look dates. So I don't think they need to be grandiose, events that have a million different, moving parts. I think that the applicants are really just looking to be able to see the physical space in which they would be training, see the area in which they would be living, and meet in person, a few of the residents and program leadership. At least that's been my understanding when I've spoken to students.
Yeah, Megan, I don't know if you want to add just from your program.
Yeah, I very very similar. I don't think I have anything new or unique to add. Yeah.
All right.
I just want to mention one other thing, is that
Yeah.
we have also tried to be clear as we can to the international graduates that are applying that these events are not like a fly across the ocean event. I think IMGs are really under a lot of stress when it comes to applying to residencies. And so that's another reason why we really wanted them to, I mean, this applies to everyone for sure, but I think in a really competitive market, especially for the IMGs, just to have this reassurance that this does not affect the evaluation of their application has been a really meaningful intervention. So, and our partners, in the organizations that connect with IMGs, we've made that clear so that they can help counsel them appropriately as well. Kylie, do you think we hit all the coordinator questions okay that might come up? I see you on here.
I think just reiterating again, the RSVP, if you can share the dates and how your RSVP is going to work in your invite information. I did that last year, and a lot of our candidates liked that because they were able to plan. We also were very specific. My program, I couldn't bring in every person who wanted to do a second look, so I had to be really restrictive. But the other side of that, and Joanna mentioning the international candidates, if you can offer some virtual offering for all candidates, do that. We did a virtual social, so it's very different than a second look, but it gave people who couldn't come to us physically the opportunity to meet our residents again, to ask questions. And for us, we do that all in 1 week. It's at the end of February for us. So the RSVP way that we're going to do it, we're not opening our RSVP until after we've locked our list. And we're communicating that to our candidates. If anything changes throughout the season, if we have to adjust the dates or anything like that, we'll send another communication out to candidates. So it's all about communication. Other than that, I think you hit all of the questions that I had.
Just another reminder that it's the part of the requirement, Olivia, right, that every person interviewed is given the same information, that it would violate what like you signed if you're locking, if you only brought a subset of applicants, if you only offered a subset of applicants an opportunity for an in-person visit. Correct?
Correct. It needs to go out to all the interviewed applicants. Knowing that can be a large amount, you certainly could note in there kind of what the scope of the in-person look would look like, so that way they have, you know, the information. And you can also set a cap. You don't, just because you're inviting everyone doesn't mean you have to ensure everybody is going to come. They just all need the information.
Other thing with the cap, I honestly work it the same way that I do invites. I let them know that the RSVP, because we take it through Thalamus, is going to be open at like 5 p.m. Eastern time on this specific date, so they don't feel, so they know exactly when to expect that invitation. Just like the invite to interview, we're trying to send it at a good time when they're not going to be in the middle of rounds on a rotation or anything like that.
Sometimes sharing what you're gonna go over is helpful. So for example, like while you have to give everyone information about the program, if you share what you're gonna offer, someone that did a rotation with you, for example, would see that there's like no value add to them coming back. Like they're only gonna see the things that they've already seen. Someone that is like from we don't have a home medical school, but someone that did like their 3rd-year rotation with us or came here to do like their sub-I with us, they will very clearly be able to see in the information we're sending out that there's like not any really additional information they would gain. So that number of 325 really comes down, you know, significantly when you take out some of those people. Yeah.
I would agree with that, Joanna. We, in our information, even go so far as to say that it is beneficial to people who have never experienced the campus, may be beneficial to people who've never experienced the campus before. We send the invitation out to everyone, but there is nothing that anyone would see on our second look that you wouldn't have gleaned in by being a student, either as a visiting student or in our home program.
No, it looks like there's some great chats in here on different ideas for that. And I'm just gonna say them out loud here just because we're recording, so that way folks will know. But one of the other ideas was to send out an anonymous interest form with the date, so they could get an idea of the many people who hope to attend for better planning. So that way they could just see how many said no or not able to attend. So we've got that.
Just want to put one more plug in, I think, before we finish, for what Olivia mentioned, that it's really going to be valuable if people fill out the survey in the month of March. so that we can get really good information to continue to revise this or adapt it if we might need to for year 2 and year 3. And then also Chris mentioned this at the fall APPD meeting, but like if a program decides not to do the lock pilot this year, it doesn't mean you can't do it next year or the year after. And also if you do this year, you don't have to continue if you decide you don't like it. So just because it is a 3-year pilot does not mean you're locked in or out for all 3 years.
All right, letting that silence linger just to make sure, but I'm not seeing any additional questions in the chat. I don't know if anyone else got any directly, but if not, we'll give you some time back. And we really appreciate you jumping on and asking all of those great questions. Again, this recording will be made available online as well, so if you need to refer back to it. I put in the chat a question responding to the number of program tracks that have said yes so far, and then said no so far, and then blank. So that's what that is referring to in the chat there. All right. Thanks everybody so much. I really appreciate you taking the time. And hopefully this was helpful to you all. And of course, feel free to reach out directly to anybody. I'm putting you all on the spot, but feel free to reach out directly to any of us if you have any questions. And have a great rest of your afternoon. Thank you so much.
Thanks for hosting, Olivia.
Thank you.